My name is Tia Beckman. I've had 2 abortions. The egg was stuck in my tube each time, and so I had my, over a course of 2 abortions, 2 fallopian tubes taken out. If I didn't have them taken out, we'd all be dead. I would have bled to death. My second one, I was in the hospital and I started bleeding. And that's how critical and that's how important good women's health care is. Abortions will happen whether they are legal or not until women's needs are addressed. If we address women's reproductive health, we can increase women's health and reduce the number of abortions. So by voting for this, you can help reduce the abortions. In 1966, according to CDC, there were 1.3 million abortions. In 2013, the abortion rates went down to 664,000. Women on Medicaid are 3 times likely to have an abortion. In Texas, since 2013, new laws that ultimately limit the number of family planning clinics is causing an increased amount of self-induced abortions. In 2 years, between 100,000 and 240,000 attempts were made while the clinical procedures declined. So it looks like there's less abortions, but the women are still trying to do their own abortions. Many women do not have, in Texas, many women do not have access to receive the medical procedure or are able to get the contraceptions. I am old enough to remember prior to Roe versus Wade, Rhode Islanders went to New York, and I would hear stories of the days of women dying, being scarred, bleeding from unsterile procedures and hangers. According to the Center for Disease Control, in 2012, there were 4 deaths associated with complications due to legal abortions. These are reported. There were no illegal abortions. In 1972, before Roe versus Wade, there were 63 reported deaths from legal and illegal abortions. That's reported again. How many women are going to report it, and the scarring, anyhow. So with legal abortions, women's death rate and number of abortions have been decreasing. An important variable to reduce abortions is access to counseling and effective and affordable contraception, according to the CDC. Insurance companies would rather pay for contraceptions than a live birth. Reproductive Health 274 supports women's reproductive health and choice. I support it. Thank you. Thank you very much for staying here and listening to all of us.